Hybrid minimally invasive esophagectomy for esophageal cancer. The definition. Esophageal cancer has the most rapidly increasing incidence in the Western world. It has 5-year survival that increases due to curative surgery. This procedure combines a laparoscopic abdominal phase with an open thoracotomy. The objective is a tumor removal causing less cardiopulmonary complications.
Hi, my name is C. Daniel Smith. I'm a gastrointestinal surgeon and the chair of surgery at Mayo Clinic in Florida. I'm also an expert in esophageal surgery, and I'm here today to talk to you about surgical treatments for esophageal cancer. Now, if you're watching this video, you probably already know a little bit about esophageal cancer and about its association with Barrett's esophagus and some of the causes. You probably also know that surgery for esophageal cancer is a fairly substantial operation which has considerable complications and even possibly death from the operation itself. Now, I'm here not to scare you, but to talk to you about some new innovations and new types of procedures that are available today to treat esophageal cancer, and in particular, procedures that are called minimally invasive surgery. Now, typically, to do an esophageal operation, you would have to have large incisions in your chest, your belly, and your neck to get at the esophagus, to remove it, cure your cancer, and then replace your esophagus with part of your stomach. Well, today we can now do these operations through some very small incisions. It could be as little as 5 very small incisions in your belly and 1 smaller incision in your neck. And now, using special cameras and telescopes and using laparoscopy and minimally invasive surgery, we can now remove the esophagus, cure cancer, and replace the esophagus with part of your stomach with much less complications and much fewer problems. For example, after a traditional operation to remove the esophagus, patients will stay in the hospital for 2 weeks or longer. And it can take up to 6 weeks to 2 months before you're recovered. With these new minimally invasive approaches that we have available, patients are in the hospital anywhere from 5 to 7 days, and within 3 to 4 weeks, oftentimes are fully recovered. So these are some pretty substantial advancements and improvements that are available today using minimally invasive surgery rather than the more complex and serious traditional surgeries for esophageal cancer.
The applications. Esophageal cancer removal reduces surgical aggression. It reduces cardiopulmonary complications up to a 50% lower risk and reduces surgical trauma.
Minimally invasive esophagectomy is performed at Massachusetts General Hospital primarily for patients with esophageal cancer, but is occasionally used in treating benign esophageal conditions. During an esophagectomy, the diseased portion of the esophagus is removed, and the stomach is used to reconstruct the esophagus. Performing the surgery in a minimally invasive fashion allows for a quicker recovery with decreased pain. Minimally invasive esophagectomy begins after the patient receives general anesthesia. The surgeon makes 5 small incisions, known as ports, in the abdomen to perform the laparoscopic portion of the procedure. Using a camera for magnification, instruments are passed through the laparoscopic ports. This process allows the stomach to be moved to replace the esophagus. In cases of esophageal cancer, extensive lymph node dissection is also performed. The portion of the stomach that will be used to reconstruct the esophagus is prepared to move into the chest. The stomach is moved to the chest, replacing the diseased portion of the esophagus. The patient is then turned and the surgeon makes 4 small incisions in the right side of the chest, avoiding spreading of the ribs. The esophagus is removed and the stomach is sewn to the remaining esophagus. Lymph nodes may also be removed at this stage. Following the procedure, the patient is awakened and transferred to the post-anesthesia recovery area. Most patients can expect to stay in the hospital for about 1 week, followed by a recovery period of 4 to 6 weeks. Minimally invasive esophagectomy has been shown to decrease length of hospital stay, diminish pain, and decrease respiratory complications compared to standard open esophagectomy. For more information on the minimally invasive esophagectomy procedure, visit massgeneral.org/MIE.
The pros and cons for this procedure. Pros: lower incidence of pulmonary complications, limiting potential tumor spillage, and its easier reproducibility of the technique makes it shorter length of the hospital stay. It's faster recovery for normal activities too. For the cons, it is unclear if the maximal benefit is in the abdominal or thoracic phase, and it's expensive. The difference with open procedure is not that significant.
We treat benign or non-cancer disease processes and as well as malignant or esophageal cancer. And so when we're talking about esophagectomy for the treatment of esophageal cancer, the way it was done before was with big incisions, a big incision in the belly plus a big incision in the chest, or a big incision that went from the chest to the abdomen. Sometimes there's a neck incision. So really we're talking about big incisions for a big operation. And with the advances in technology and surgical technique, now we're at a place where we can do that operation, esophagectomy, with a minimally invasive approach, meaning small incisions, Band-Aid type incisions, which, for the patient gives them the advantage of, less pain, gets them up and moving around, gets them back to get home and to working sooner than before. So really there's multiple advantages to doing it with a small incision, but still doing those operations the same way it was done when it was open. As far as the benign esophageal surgery, things like motility disorders, hiatal hernias or diaphragm hernias, benign tumors of the esophagus, all those things now can be done with those small incisions.
For the issue applied in Ecuador, this procedure is actually not normally used, but the Luis Bernaza Hospital has been using endoscopic gastrostomy since 2008. For the conclusion, it has a lower incidence of intraoperative and post-operative major complications. According to the location of the clinical stage of the tumor, will decrease all post-operative complications and may yield the greatest benefit from surgery.
My name is Dr. Michael Wallace. I'm a gastrointestinal specialist at the Mayo Clinic in Jacksonville, Florida. We've been very actively involved in developing new methods to improve the care of patients with esophageal cancer. Recently, we published a study that showed that a less invasive procedure was equally effective as the more invasive surgical options for removal of early-stage esophageal cancer. Esophageal cancer is a relatively uncommon cancer, but it's rising quickly in the United States, and in fact is the most rapidly rising cancer in the developed world. Esophageal cancer, particularly the form that affects the lower esophagus, is a condition that develops particularly in people with chronic acid reflux disease. In those individuals, we now have the ability to screen for the cancer by an endoscopy, and that allows us to detect earlier cancers, those that develop before symptoms develop. The symptoms that may develop include difficulty swallowing or unexpected weight loss. When we do an exam and we detect an early cancer or precancerous changes in the esophagus, traditionally the only option for treatment was surgical removal of the esophagus or very intensive monitoring. Now a new option is available called endoscopic mucosal resection. In this procedure, we can remove the tumor and precancerous changes through an endoscope without removal of the esophagus, a so-called organ-sparing treatment. In this study, we evaluated the long-term outcomes of the endoscopic procedure versus the traditional surgical procedure. We did this using a large national database available across the United States that monitors the effectiveness of cancer treatments. We evaluated more than 1,600 individuals with early-stage cancer of the esophagus, and we found that those that got the endoscopic treatment had equally good outcomes to those that got the surgical treatment. Also, we found that the endoscopic treatment is increasingly being used, whereas early on in the study, more than 10 years ago, only 1 in 30 patients got the endoscopic treatment. Now nearly 1 in 3 are treated with the endoscopic treatment, and that number is continuing to increase. Overall, the main value of this study is that it reassures patients and doctors that the less invasive endoscopic treatment appears to provide similar outcomes compared to the more involved and slightly more risky surgical treatment. For patients, I think this gives a new option for less invasive organ-sparing treatment. Thank you.
Thanks for watching.